When you look at your plate, you want to have at least 4 colors on your plate. Colors represent antioxidants. Antioxidants represent heart health, period, end of story. Antioxidants gather up free radicals in our blood that cause us to have plaque, heart attacks, strokes, high cholesterol, high blood pressure. So if the more color you have on your plate, the better off you are. Also, I think that 3/4 of your plate should be in some form of a fiber. Protein should take more of a back seat, and really the star of the show should be the vegetables and the fruits that are on your plate.
We're going to talk tonight just briefly about a general overview of a heart-healthy diet. I just want to kind of there's every kind of diet imaginable. You type in diet on the internet, I'm sure there's a diet for everything. Patients that come see me in the office, we talk about a couple of key things, particularly things that will lower your risk for heart disease, either developing heart disease or having a heart attack or a stroke. And so a quick overview. So 3 big topics. One is fat. The easy thing to say is have a low-fat diet or cut fat out of your diet, which is actually not true. We're going to talk about why fat is very, very important to a healthy lifestyle and a healthy body, and what types of fat are good for you, promote good heart health, and which types of fat are actually very, very bad. And then moving from what we call the low-fat diet to a right-fat diet. Fiber, another big thing. Fiber is kind of correlated to cellulose, but why fiber is important, why having a high fiber diet will lower your risk of heart disease. And then the last part is, this is a common thing. I come, as a new young physician, talking to people, twice my age, is it too late? I'm 50, 60, 70, 80 years old. Does a diet really matter? Do I just need medication? Will a diet actually make a difference in my lifestyle? And we're going to talk about why it is important and why it will make a difference. So one is fat. Now, everybody that has fat has a bad name for itself. It's really kind of created a bad rep. It has a very bad PR agent. But fat is actually the number 1 source of energy in all adults. It's the precursor, so kind of the backbone for all hormones. You've heard of bile acid in your gallbladder. That's the precursor, vitamin D. And it actually forms the basic structure of all cell walls. On the left side is a red cell wall. And so what happens is things come in and out of the cells. So you have glucose, potassium, sodium. Things go in and out of the cell walls, and they have to pass through the cell wall. This is a cell wall made primarily of saturated fatty acids. And don't pay too much attention, but this is the bad fat. Okay, so every cell in your body is made up of either good fat or bad fat. The good fat, things have a very difficult time about getting into the cell. You can see how tightly packed together this cell is. Everything's very strict in line. This is not like the military where order is good. Right? You need a little bit of space so that things can pass freely in and out. And primarily, this is glucose. So this is kind of the basic pathophysiology behind type 2 diabetes. Glucose has a very difficult time getting through tightly packed cell walls. So cell walls that are made up of saturated fatty acids prevent easy transport in and out of the cell. All right? And then we talk about the different types of cholesterol. So there's LDL cholesterol, HDL cholesterol. In your body, again, needs these types of cholesterols. These play important roles, but the problem is that LDL cholesterol starts in the liver, and it carries fat, which is essential, to all the different cells in the body. So it plays a very vital role. The problem lies in that LDL is attracted to the inside of all of your arteries. And so if you have too much LDL, or the bad cholesterol, and you start to have some damage to the inside of the arteries, then this LDL cholesterol will start to build up. And that's what forms plaques, or you've heard of heart disease, atherosclerosis. That's what's behind this. The HDL cholesterol is the good cholesterol that actually goes through and scavenges extra cholesterol, extra extra LDL cholesterol, brings it back to the liver. So the HDL cholesterol is the good cholesterol. It soaks up extra cholesterol, breaks down plaque. That promotes good health. So going into the types of fat. So the first slide where we had the cell membrane, and we talked about the things that were tightly packed. It was difficult to move things in and out of the cell. Those are trans and saturated fats. All right, so we talked about these, and most came from New York City immediately. Trans fats were illegal. You couldn't actually even use these to cook. If you're looking at cooking oils or products, you will see it says partially hydrogenated vegetable oil. Those are trans fats. And what happens is you have these trans fats have a much longer shelf life. And so trans fats are usually used in processed foods. So if you think of Cheese Whiz that I used to love as a kid, it's all trans fat. It lasts on the shelf for years, which is not good because when it gets into your body system, trans fats are highly, highly associated with obesity, diabetes, heart disease. So we want to stay away from the trans fats. Saturated fats are, again, these are fats, and kind of, it's important to know the names, but the easy way to remember these types of fats are, if you look at something at room temperature, so we're going to look at the table here, just for example. This is a liquid at room temperature, right? So you have extra virgin olive oil. That's good. So you want something that's liquid at room temperature. That way, when it goes into your body, it's going to remain liquid and easily mobile. So things over on this side of the spectrum, these monounsaturated fats or polyunsaturated fats, these are the good types of fats that you want to include in your diet. All right? So you want to avoid the saturated fats, butter, red meat, cheese. Again, to a certain degree, everybody needs some cheese, but cheese, ice cream, whole milk, these at room temperature are solid fats. Those are, you can imagine what that would look like in your body. So you want to stay on the right side of the spectrum here. Talk about the right fat diet. All right, so I'm going to put two diets up, and I apologize for anyone that came to an earlier talk, but this is kind of a repeat slide. We're going to walk through two different types of diets, and I just, a show of hands of which, either the left side or the right side would be the diet that would lead patients to have lower risk of heart attack or a stroke. So on the left side, we have a doctor or someone telling you, listen, you need more than 4 tablespoons of olive oil a day. A tablespoon, so 4 tablespoons of olive oil a day. Right? Someone's telling you to drink or eat that. You want to eat a lot of tree nuts, which are cashews, walnuts, macadamia nuts, fresh fruits, vegetables, fatty fish, seafood. They tell you need to drink a glass of wine with every meal, versus cut out just low-fat dairy products. You stress whole grains, fresh fruits, vegetables. If you eat meat and soup, but just cut away any visible fat, and you discourage any nuts, any fried snacks, discouraged vegetable oil, discouraged olive oil. I don't want to put anybody on the spot, but the left side here is the Mediterranean diet. All right, the right side is what has been touted by the American Heart Association, the American Medical Association for the past 20 years as the low-fat diet. The answer, this has kind of been our go-to diet to decrease your risk of heart attack or a stroke. This is, there are a number of studies that have been published in the past 5 years. This was a very, very big publicized landmark trial that was published in the New England Journal of Medicine last February. This diet, over the course of 4.5 years, patients that followed this diet versus the low-fat diet had a 30% reduction in their risk of heart attack, stroke, or death. And they actually had to stop this trial early because patients that were in this Mediterranean diet versus the low-fat diet, the investigators thought that we're actually causing people harm by having them follow this diet compared to the other diet. So they had to stop this trial early because there was such a difference. All right? And we'll get to kind of the characteristics of these patients, but these were all men and women, and the average age was 68. in this trial. So these were definitely, this was definitely a very, very significant trial. Fiber, moving on. So we're going to, fiber, everyone probably kind of knows about fiber, or at least has heard of it. One thing is, so it decreases your bad cholesterol. And the way it does that is fiber is not absorbed into your, it's not absorbed from your digestive tract. So when you, I tell patients if a glass of Metamucil, all right? So if you've ever seen Metamucil, you stir the fiber, and there's this big clump at the bottom, right? That's what it looks like in your intestines. And what it does is it absorbs cholesterol in the gut. So when you eat fiber, it naturally absorbs cholesterol, and that prevents it from the cholesterol from being absorbed into your system. It also promotes good intestinal health. If anyone here has had a colonoscopy and been told you have diverticulosis, the treatment is to increase the fiber in your diet. And weight loss, who doesn't, it's a cheap way to lose weight. So if you look so 400 calories of the olive oil I just told you you need to eat every day takes up about this much space in your stomach. So you can eat all the olive oil or unsaturated fats, but you're still going to feel hungry. If you have 400 calories of chicken, you have about this much room in your diet. Now, 400 calories of a nice green, crunchy, healthy salad will actually make you feel full or create satiety much more quickly than the equivalent of these kind of bad foods. So fiber is a very, very good food, very important for a number of reasons. And there are many sources of fiber, fruits, vegetables. Right? These, really want to stress, should comprise the majority of your diet. So if you look at a plate of food, really at least half of it should be full of fruits and vegetables. And then whole grains. And this was, I've kind of preached the concept of whole grains, but was never really even told or taught what a whole grain is, what that means. And I grew up in Ohio, which is a corn belt, so I should know this. So, forgive if someone knows this, I don't want to be redundant, but the whole grain, so when you have a kernel or a seed, you have the husk, or the bran that kind of is the coating of the seed, protects it. Then you have the germ, which it provides all the nourishment. It's almost the yolk for the seed, so it provides all the nourishment to the forming seed. And then all of the carbohydrates or the energy. And so when grain is processed or milled, if you have whole grain, they include everything here. And you can see that all of the really beneficial parts of a grain are everything on the outside. The bran and the germ, that's where the fiber is, that's where the vitamin B is, that's where all of the iron, all of these important nutrients, whereas all of the, I don't want to say bad things, but all of the energy or carbohydrates are in the endosperm. And so if you are eating just kind of white bread or regular grain, you're eating all the carbohydrates and missing all of the positive benefits. So that's why whole grains are the best. If you're going to eat carbohydrates, and you should, try to stick to whole grains. Now, is it too late to change? And again, going back to the chart I showed between the two diets, the Mediterranean diet versus the low-fat diet. Just a quick, if anyone's brave enough to kind of shout a response. I told you what the average age is, but so 69 years old in this trial, right? Who, just if you feel brave enough, what percentage do you think were smokers? Either current smokers, they'd quit in the previous 5 years. About 50% were smokers, right? The percentage that were obese or morbidly obese, about 50%, right? The percentage that had hypertension, so they were actually taking medication to lower their blood pressure. Close? 80%, right? 80%. The percentage that had diabetes, they were taking either insulin or medication to lower their blood sugar. 50%, okay? The percentage that were taking a statin or medication to lower their cholesterol. 70%, right? 4.5 years, patients following this diet had a 30% less chance of having a heart attack or a stroke, right? And these are, again, look at the demographic here. It's not too late, all right? This diet is the cornerstone of any treatment for heart disease, high blood pressure, diet, or high cholesterol. Diet is the most important part of that the treatment. And so, this is kind of a nice segue into the next segment where we really want to provide a visual experience, have you see kind of what raw ingredients look like, and then how we can put them all together into these just amazing dishes. The Mediterranean diet, I see people are taking notes here, there are a lot of resources on the internet about the Mediterranean diet. And we will, on our website, post a copy of this talk, as well as some other information about where to go for recipes, or for just other information. And this is my phone, or our phone number, the office here. And I welcome anyone that, if patients that already see me, this is kind of what we talk about in our visits when we talk about your cardiovascular health and screening. But this is really important, and I welcome anybody that wants to talk about it afterwards, but I don't want to take away from the important part of tonight, which is the food and the cooking demonstration. So thank you all very much.